Good morning and welcome. Thank you for joining us today. My name is Scott Harris, and I'm the State Health Officer with the Alabama Department of Public Health. We're very excited to have you here today as we reveal some new news about our eWIC program. eWIC is a special supplemental nutrition program named Women, Infants, and Children, and it's a program of the United States Department of Agriculture. The mission of the eWIC program is to improve the health and nutritional status of women, infants, and children during critical times of growth and development. The Alabama eWIC program provides nutritional education and food benefits to over 120,000 people statewide. We have about 638 vendors in the state who are involved with the eWIC program, and that corresponds to about $97 million in eWIC vouchers being redeemed in the past year. Now, $97 million to Alabama businesses is a big deal, but what's really a big deal is the way that we're able to reach these very vulnerable populations with pregnant women, with women that have small children, and with those infants and those children themselves who are able to receive nutritional support. Today marks a rollout day for our eWIC project, our Electronic Benefits Transfer Project, which we'll be doing on a pilot basis in Montgomery, Autauga, and Elmore County. And now I'm going to turn it over to Amanda Martin, who's the Alabama eWIC Director. Amanda.
Thank you, Dr. Harris. And I just want to echo, it's a very exciting day for the Alabama eWIC program. We currently operate what we call a voucher system. So our participants are receiving paper food instruments that they take and redeem at our stores. As part of the 2010 Healthy Hunger-Free Kids Act, all eWIC programs nationally were mandated to go to electronic benefits transfer. So, and that was by October 1, 2020. So we're meeting our goal. In Alabama, we're calling this eWIC. We started working towards this milestone in 2009. So we're truly excited to be in Montgomery, Elmore, and Autauga counties today. I was in Elmore County this morning, and I didn't meet a person that was not smiling. We are doing pilot in 2 phases. So in a couple of weeks, I'm just going to point to the map here, and we're going to start working up the state of Alabama. We're going to pick up the remainder of the East Central District, which is your light purple color. We're going to move up to the state to the darker colored purple part of the map, which is the northeastern district. So pilot phase 2 is going to be East Central and northeastern districts. And then we're going to rotate around the state in the next 3 months, going up to the northern district in red, working our way all the way down to Mobile County and back over to the eastern part of the state. So in all, we are going to be reaching about 120,000 participants, and as Dr. Harris said, over 600 vendors are going to be providing these benefits to our clients. I want to thank all of the program staff that were involved with this, our state office staff, our clinic staff, our district staff, and Dr. Harris for your support as we implement this fabulous milestone in Alabama. Next, I'm going to introduce Stacy Newman, which is our Vendor Manager Director and also our eWIC Project Coordinator.
Thank you, Amanda. I'm very excited to be here today. As Amanda said, I'd like to echo, it's a very exciting time for our eWIC participants as well as our authorized eWIC vendors. I appreciate the opportunity to be able to thank our authorized eWIC vendors. Implementing eWIC could not be done without them. They have a tremendous amount of work that they have to do to prepare their registers to get ready for eWIC. I was fortunate enough to go out in the field last week and view some certifications, and we are live and up and running today, and it is very exciting. eWIC is going to bring many benefits to our participants as well as our authorized eWIC vendors. For the participant, it creates a much less stigmatizing transaction because it is simply swiping the card and entering the PIN and purchasing what they need to purchase at that time. For the vendors, it provides a smoother in-lane transaction, and they also receive electronic payment in a more expedient time than with paper vouchers. And there's less chance of error in the vendor community. Previously in paper, the responsibility is on the cashier, and so with eWIC, it alleviates some of that responsibility on the cashier. So we're very excited. We appreciate all our authorized eWIC vendors for all the hard work they've done. And now I'd like to introduce Miss Ellie Taylor, who's the president of the Alabama Grocers Association. She is a very valued partner with the Alabama eWIC program.
Thank you, Stacy. And I just want to say thank you so much to Dr. Harris and to Amanda. We've been working with the department on this project since the very beginning back in 2009, and our retailers are very excited about what this program brings. As Stacy said, when we do a transaction now in the store, it'll be an inline transaction, so no longer will WIC participants have to separate out all their products and do each item with a separate check, and so the in-lane experience is just going to be so much more enhanced. They can buy their WIC products along with all their other products and pay through different venues, their eWIC venue, but then also pay cash or credit card or however else they need to pay for their items in the store. The other thing it does is it takes the onerous off the cashier in the store to have to check the WIC vouchers, check the signatures, check and make sure it's the correct participant. Now they'll have the card, they'll put it in, they'll insert a PIN number, just like you do with any other kind of debit card that you use from your bank, and it just makes that customer experience so much better, not only for the WIC participants, but also for all the other customers in the store. It also keeps real-time data, so pricing data. So as prices increase and decrease, those adjustments can be made, and the retailers no longer will get checks back for different price differentials. The payments will be put directly into the bank, and any changes that need to be made will be made then through the department, and so it'll be much less of a burden on the retailers with the WIC checks as well. So overall, we're very, very excited. We know this is going to be a great thing for the participants and for the grocery community and other retailers that service WIC, and we're just so proud and happy to have been a part of this from the very beginning.
Thank you very much for joining us today. I don't know if we have any calls to answer, but we'll be happy to do that. We'll remain here for a few more minutes. We appreciate you joining us.